Today we're going to be focusing on the mechanisms of resistance to treatment in men with metastatic castrate-resistant prostate cancer, we'll call CRPC, and in particular the role of the androgen receptor splice variant 7, also known as ARV7. Continued targeting of androgens and the androgen receptor have resulted in important clinical benefits for patients with metastatic CRPC, but despite the efficacy of these agents, some patients do not respond. So, Eleni, can you tell us what's known about the resistance to AR-targeted agents and specifically about resistance to abiraterone and enzalutamide?
Thank you very much for this question and the opportunity to share all this information in the conversation with both of you. So, essentially, we should probably first define the groups of patients based on their response to abiraterone. We have what we call primary resistance, and then we have secondary resistance. Primary resistance is self-explanatory. People who never respond to either abiraterone or enzalutamide and usually progress within a short time frame. That may be 3 to 4 months, and it's pretty obvious in the clinic. It's clinical progression, it's radiographic progression. There are some data that in earlier disease stage, pre-chemo, it may be also associated with some biochemical markers such as PSA, remains to be defined. However, it's not difficult to figure it out. Secondary resistance is broken up in two groups. Those patients that may progress sometime between 6, 8 months, get in trouble gradually, and then the ones who are later in the day performing poorly after a great initial response where you essentially forget about the problem for a while.